Good afternoon, ladies and gentlemen of the media, and to the Bermudian public that are watching at home or listening to the radio. I trust that all Bermudians had a restful and blessed Easter weekend. And today I'm joined for this press conference by the Minister of Health, Kim Wilson, the Minister of Labor, Community Affairs and Sports, Minister Fogo, and the Minister of National Security, Minister Wayne Keynes. We are also joined by the Chief Medical Officer, Dr. Cheryl Peak Ball, who will able to answer any questions, medical questions, which may come later today. First minister to speak will be Minister Wilson, the Minister of Health, with an update on the latest with COVID-19. Minister.
Thank you, Premier. Good afternoon, everyone. Today, there were no test results received. However, an estimated 39 are being processed as we speak. Sadly, another individual has passed away, and on this occasion, a senior who had been recently hospitalized. I want to begin by sending my sincere condolences to the family of that individual, and please know that the entire government, as well as the Ministry of Health team, offer our sincere condolences as you grieve the loss of your loved one. Bermuda's total confirmed positive cases remains at 57. 30 have now recovered fully. 6 persons are hospitalized. 3 of those persons are in ICU, and there are 16 persons under active public health monitoring, but who do not require hospitalization. Today's good news is that another patient has been discharged from hospital. The age of persons hospitalized ranges between 67 years and 78 years, and the average age is 72. The average age of all confirmed positive cases is 52. The median age is 53, and the age range of all our positive cases ranges between 18 and 86 years. Out of the 57 positive confirmed cases to date, 31 are males and 26 are females. And as I announced last evening, the Ministry of Health's Epidemiology and Surveillance Unit received laboratory confirmation yesterday of COVID-19 in 2 residents and 2 staff members at the Matilda Smith Williams Resident Seniors Home. Public health actions and contact tracing is actively occurring. Unfortunately, these results did confirm to us that there was spread of the virus within the facility. This is the second care home where there has been a positive case involving staff member, and we are all understand the higher risk as it relates to seniors. And as a result, care home residents and staff at Matilda Smith are being tested for COVID-19. More than 50 people are being tested, and we expect the results within the next 24 to 48 hours. The team is The team is working with all rest homes to ensure staff and residents are as safe as possible. The country's testing capacity will continue to prioritize rest homes and other high-risk persons. The outbreak is being managed by strategies put in place prior to the cases being confirmed, and these will continue, and they include no visitors to the facilities, emphasis on infection prevention and control hygiene practices, enhanced daily monitoring of staff and residents' health, isolation of any symptomatic individuals, and exclusion from work of any staff with symptoms consistent with COVID-19. Enhanced cleaning and disinfection is currently taking place. Disinfecting wipes have been provided by the Department of Health to all facilities. The confirmation of COVID spread at rest homes underscores the importance of our decision as a government to proceed to amend the Bermuda residential care and nursing home regulations to prevent employees from working at more than one site where there is a risk of communicable disease spread. Some private homes have since followed this example. Our residential care homes regulation officer has been communicating with the homes and asking them to stop the practice since March. We hope this will safeguard our residents from COVID-19 by eliminating any potential transfer of the disease among the different long-term care homes by unknowing staff members. We know the sacrifice our healthcare workers are making, both in the long-term care homes and within our community, as unlike many in Bermuda, they cannot shelter in place or work remotely. We are supporting them as much as we can by providing them with the requisite supplies of PPE, regular guidance, and funding for resources as needed. There is no wish to place restrictions on anyone, but in this instance, it is for the safety and health of the community. The Bermuda Health Council is in the process of compiling a list of potential substitutes that could assist with staffing shortages due to the change in the legislation. Since January, there have been extraordinary efforts to prevent COVID-19 from entering our care facilities. This is a global pandemic, and Bermuda has local transmission, and the efforts are highly and rightly focused on managing and containing the spread. The homes have been on high alert since the beginning of the year and have been working tirelessly on preparing and equipping the homes for COVID-19. This started with plans for restriction of visitation, cleaning and disinfecting the facilities, planning for expected staff shortages, training on use of personal protective equipment, and so many more details that have been critical to putting us in a more controllable position. Visitors have been canceled to homes since mid-March, and the staff without symptoms have been provided with masks. The residential nursing home care team has required the staff to take their temperatures at the door. Heightened infection control measures and changes in behavior such as not wearing their uniforms outside of the care homes are also included, and residents would also have their temperatures, blood pressure, pulse, and general well-being assessed daily in efforts to detect early warning signs of the residents being unwell and support early interventions. We're currently securing the supply chain for thousands of units of supplies and meals for the upcoming months, filling the position of staff that may be unable to work or require isolation, obtaining additional transportation for essential workers, and maintaining clear and constant communication with the hospital on potential transfers. Many of these precautions we have seen have been adapted worldwide, but have proved to be no match for complete protection against COVID-19. However, we must not lose heart. We must remind ourselves that the picture would look alarmingly different if we did not take such protective actions and measures. Therefore, this is also a time to remind the community at large of the additional measures that should be taken to protect our most vulnerable, those with health conditions such as severe asthma, cancer, poorly controlled chronic conditions, especially related to heart disease and respiratory illnesses or diabetes. The precautions are called shielding and require these persons to stay home, strictly avoid contact with someone who is displaying symptoms, and anyone coming into their home should wash their hands with soap and water for at least 20 seconds. We know we are all judged as a society on how we protect and support our most vulnerable. Let's all do our best to protect ours. The Ministry of Health is currently working tirelessly to do what we can, but this is all about all of us as a community doing our best. We will be issuing further guidance surrounding the shielding that I just spoke about tomorrow. Thank you, Premier.
Thank you, Minister. On behalf of the government and the people of Bermuda, and also my family, I extend my sincere condolences to the family of the person who passed away today. Sadly, at these press conferences, we refer to our fellow Bermudians as numbers of statistics which are to be reported. But these persons are far more than numbers and statistics. They are someone's father, they are someone's mother, they are someone's friends, they are someone's family. And each of these individuals have been a part of the rich fabric of what makes us a country. We mourn with you, we grieve with you, and we will continue to redouble our efforts to ensure that we can limit the amount of future loss of life. The losses that Bermuda has experienced over the last few weeks underscores the importance of social distancing. As a country, we must stay home and move around as little as possible. We must only leave our homes to visit the grocery store, pharmacy, or gas station for necessities and not for a social outing. Staying in our homes may seem like a simple measure, but scientifically, it is the most effective way to reduce the spread of a highly contagious disease. This Easter weekend, the vast majority of Bermudians adhered to shelter-in-place guidelines, leaving their homes only for those essential items. However, the Bermuda Police Service continues to run into persons who are not taking these restrictions seriously. And there are continued reports of persons who are not doing what they should do. The overall aim of what we are doing as a government in this shelter in place is to save lives by limiting the transmission to ensure that we do not overwhelm our hospital. And the only way that we can do that is by people following the instructions and remaining home. I also want to remind everyone, giving thanks to the grocery stores who have signed on and the other establishments that are requiring persons to have their face covered as they move inside. It is important that if you do go outside, if you are an essential worker, if you're somewhere, please make sure that you wear a face covering. It is particularly important at this time where there are persons who are asymptomatic transmitters of this virus. I did receive a question where someone asks, what does asymptomatic mean? This means that you could don't have a fever, don't have a cough, don't have a sore throat, aren't experiencing any symptoms whatsoever, and are feeling perfectly fine and healthy. However, you may be an unknowing carrier of the coronavirus. And if you are, you could, by an interaction with someone, by some reason you're not sick, so you ended up touching your mouth or something, you did not wash your hands, you did not practice good hand hygiene, and you managed to pass that on to someone else unknowingly. Some of the statistics of which we've seen have said that there are persons who are asymptomatic who are carrying this virus. That is why it is important for all of us to cover our faces when we go out into public. This, unfortunately, is the norm in many countries around the world and will soon become our new normal as we work to make sure that we can continue to combat this virus. As a reminder, we should try to reserve surgical masks or N95s for healthcare workers, but wear any covering that you can, and if you want to learn how to make a covering yourself, you can go on our website, coronavirus.gov.bm, for instructions on how to make your own face cover. If you subscribe to our government WhatsApp, you would have seen a wonderful video received today from the Chief Medical Officer where she discussed this very important issue. Right now, Minister Keynes will give an overview of the Bermuda Police Service and the Royal Bermuda Regiment activities over the past weekend and some other details. Minister?
Thank you, Premier. Over the holiday weekend, the Royal Bermuda Regiment and the Bermuda Police Service, they were deployed across the island. The community advisory points recorded a total of 18,083 stops over the holiday weekend, and the breakdown is as follows. Good Friday, there were 5,056 stops. On Saturday, there were 10,025 stops. And on Easter Sunday, there were 3,002 stops. Over the past week, there were 32 arrests in total. 21 of the 32 arrests were for curfew violations. 11 were for essential movements. In other words, people that were out without a legitimate cause. And the Bermuda Police Service issued 111 warnings for breaches. Over the weekend, the Coast Guard conducted maritime controls in the east and west ends of the island, covering all harbors and most inlets. On Sunday, various vessels, including 10 registered fishing vessels were stopped. Kayakers were intercepted at Abbott's Cliff in Harrington Sound. Swimmers were issued advisories in St. George's for not keeping the shelter-in-place regulations. I want to take this opportunity to remind the public that under the current shelter-in-place guidelines, they are allowed to move about for legitimate reasons only during the hours of 7 a.m. to 7 p.m. Turning to government-run quarantine facilities. Currently, there are approximately 215 individuals in 5 facilities. I wish to extend our appreciation to the Bermuda Police Service Reserve officers who are working with our Disaster Risk Reduction and Mitigation Team, or the DERM, as all of our quarantine locations. I would also wish to take the time to commend the members of our DERM team who for the past 4 weeks have done a yeoman's job in managing these sites, often under incredible demands and strain. Throughout it all, they have demonstrated extreme professionalism, integrity, and as minister, I am very thankful and grateful for their service. This week, the quarantine facilities will continue the essential care package drop-off, which will take place tomorrow, April 14th, and Friday, April 17th. The drop-off time is from 1 p.m. to 5 p.m. Again, the essential care package should contain key items such as toiletries, medications, essential foods, inclusive of all special dietary items. Thank you.
Thank you, Minister James. Part of coping with the effects of a global pandemic is to take care of those persons who have been dislocated economically. What do I mean by that? We have a large number of persons who, due to no fault of their own, whether they worked in tourism or in a business that has been required to be closed, are not able to earn an income because they are unable to work from home and their business is not deemed as essential. I have stated before that this pandemic will cause significant economic damage to our economy, but that does not mean that the government is powerless. We do have the ability to help. Minister Fogel will speak next on the fact that we have provided a significant amount of money to those persons who have, due to no fault of their own, been unable to earn an income. And I'm proud to lead a government that responded very quickly to make sure that persons in need in our community would not starve and would have the resources which they need to survive during this very difficult and challenging time. Minister Fogel?
Thank you, Premier. Good evening to the viewing and listening public. This government has been humbled to do what was necessary to financially assist our fellow Bermudians during this pandemic. Whilst there are a number of applications in train, to date, some 3,811 persons have been paid for a total of just over $3.4 million. Many have received their initial payments, and more will be receiving payments today and on Friday. By Friday, an additional 1,197 applicants will have been paid for an additional cost of $966,000, bringing the total applicants paid to 5,008 persons. Those who have received their unemployment benefit will have received 2 weeks of the benefit, and as the 2-week anniversary approaches, they will be eligible to receive another payment. This will continue until they are either reemployed or the 12-week benefit is up. In this time of uncertainty, the government wants to make sure that no one is going hungry and that no one is being left behind. To further speed up the payments, we have brought in staff from other government departments to assist, and they are working with the larger employers to speed up the application process. We are here to assist and to ensure that no one falls through the cracks. As a reminder, applications can be made online through either the Bermuda Job Board or at www.gov.bm. You do not need to pay a fee to anyone to assist you in submitting an application. There are a number of helpline numbers to call for assistance, and I'll just state them. 297-7714, 297-7716, 707-5439, 707-5438, 707-5440, and 707-544-2. The numbers beginning with 707 can also be contacted via WhatsApp. Our team in the Ministry of Labor, Community Affairs, and Sports continue to review the submitted applications to ensure that the applicant is eligible. They are approving and processing for payments for those who are. We are working diligently to get these payments to you as quickly as we can. A number of payments have been delayed as applicants have not keyed in their correct bank account details. So please take care when completing your application to ensure that you have keyed in the correct details and have the supporting documents attached to your application. We recognize that there are a number of self-employed Bermudians who are not registered with the Office of the Tax Commissioner, making them ineligible to receive the benefit. We recognize that some of these individuals are struggling financially, and we are currently looking at ways to assist them. For those who are not eligible for the unemployment benefit, there are a number of options available under our consideration. And I just want to make it clear that this government's intention is that no one will go hungry. So please reach out if you are in this predicament and require assistance. Bermuda, we are our brother's keeper. We will get through this together. Thank you.
Thank you very much, Minister Fogo, and I'd like to give tribute to you and your team for working so quickly to make sure that we can get this assistance to Bermudians who certainly require it during this very difficult time. As the Attorney General and Minister for Legal Affairs, Kathy Simmons, mentioned last week, the shelter for Bermuda's homeless and vulnerable population moved from the Barclay Institute to the temporary shelter-in-place accommodation at the Cedar Bridge Academy. The shelter is fully operational, providing 24-hour accommodation for those who need it. The facility is managed by the team at the Department of Child and Family Services with professional assistance from the Mid-Atlantic Wellness Institute and the St. John's Ambulance. There is currently a need for medical support between the hours of 8 a.m. and 6 p.m. I will echo the request made by the Attorney General last week. If there are nurses and doctors who are able to volunteer their services at the shelter, they should contact 707-2223 for more information, and the government will welcome your assistance. The temporary shelter, with appropriate social distancing in place, has 40 beds available, and over the last 2 nights, 33 men and 4 women were accommodated. Many would have heard helicopters flying overhead earlier today. Last week, Government House announced that RFA Argus, a ship of the Royal Fleet Auxiliary, would be anchored in Bermuda's waters today and tomorrow. While here, 2 helicopters from RFA Argus will conduct familiarization flights over helicopter landing sites around the island. This was last done in 2014 and is a key part of the hurricane preparedness plan for Bermuda. It should be noted there was no contact between the ship's crew, helicopter pilots, and any onshore persons. The Argus is also collecting supplies before heading to the Caribbean as part of the UK's preparedness support, and the ship will stay at anchor and no one will disembark from the vessel. There were also a number of media queries earlier today regarding an advertisement for a private jet that was looking to return persons to the United States. I would like to remind everyone that before any jets are given permission to come to Bermuda, they have to meet a number of criteria. That permission is not automatically given, as any jet that is returning residents to the country must use extra seats to return stranded Bermudians back home. The flight that was advertised earlier today has not yet received the required permission to land in Bermuda. We have a process, and I would encourage that all persons follow the process and not advertise something before the required permissions are received. The government will be looking to adjust our policies going forward to match those seen in other countries, where persons in government quarantine facilities pay for their accommodation and food. The Cabinet will be meeting tomorrow to approve this revised policy, and it will be communicated to all persons. Last week, I touched on the Emotional Wellbeing Helpline. The Emotional Wellbeing Helpline, which can be called at 543-1111, opened on Friday, April 10th, and it has received 32 calls as of last night. As a reminder, the service is anonymous. If you have questions or concerns around your own mental health or how to support friends and family who are dealing with loss, anxiety, and other feelings that can be overwhelming, please make use of this service. And that number, again, is 543-1111. In closing, lives have been lost. Families have been forced to say goodbye to loved ones before their time, and yet there are still persons on this island who seem to think that this situation of this pandemic is a joke. I must stress again that if you do not care about your own life, please show some compassion and respect for the lives of others. It is clear that we can only stem the tide of COVID-19 if we remain calm, remain disciplined, and most of all, remain united, recognizing that in this we are all our brother's keeper, and the only way that we can keep our country safe is for all of us to do our part. Thank you, and I'm happy to take any questions from the media at this time.
Premier, with that said, on your last address just now, with the numbers of individuals arrested, the disobedience of individuals on trails and out doing whatever, coming this Saturday is the end of the shelter in place. Are we heading for a 21-day, 24-hour lockdown?
Mr. Lindsay, there has been no change to the government's position at this point in time. As I mentioned in my speech earlier, the Cabinet will be meeting to discuss all matters tomorrow, and if there's any change in the position of law at that point in time, we will certainly communicate that to members of the public.
Can I ask Minister Wilson, you identified, or Matilda Smith, Senior's home was identified. You didn't identify another home. Is this Senior's home eastern end or in the central ends of the island, or you cannot identify the
The other home that I was speaking to, I don't know exactly the home in at this particular instance. However, it was a home with respect to a person that tested positive, not as a resident, but as a staff member. I don't know if the nurse epidemiologist can provide a little bit more information with respect to the level of interactions and intervention that took place with respect to that particular home.
So yes, a staff member had tested positive, and in response to that positive result, contact tracing took place, which involves interviewing that person and finding out their activities during the period where they would be deemed potentially infectious. And those persons deemed as close contacts were contacted and public health advice was given.
Can I also ask, because we have a family member, grandfather, an individual that passed, and he was diagnosed basically with pneumonia, but he's been told that he died from COVID-19. And will there be autopsies on these 4 or 5 persons that has passed thus far?
I can't speak to that specifically. That would be a decision of the coroner.
Okay. Minister Keynes, can I ask you that TNN understands that a couple of senior officers, matter of fact, one senior officer was seen on the trails over the weekend, and another officer has had construction being done on his house during this shelter-in-place time period. Is these individuals, these officers, going to be arrested, and are they going to be charged?
The Commissioner of Police is present, and I'll ask for him to take those questions.
Trevor, I'm aware of the case you mentioned, and you're right to say 2 officers and the nature of the allegation. There were 19 persons stopped on the railway trail this weekend, and all of them have been reported for summons. That is, the matters are sent to the Director of Public Prosecution's office for them to consider action under the regulations. Within that, one of them was a police officer, and that file is included with the other 18. So that person, that officer, has been treated no different than any member of the public. The additional officer that you mentioned with the construction work at home, again, a file has gone to the Director of Public Prosecution's office for review. Police officers are not above the law, and actually they're there to work with people, and the last thing we want to do is enforce law. We want to give them directions. But police officers are accountable, they're no different, and the trust in the community is that we deal with such matters, and indeed we are.
Can you confirm it's in your office at that?
It's on social media, so obviously there is some accuracy. I'm not going to say who, because I think that's inappropriate, but I think judge what's on social media.
What warrants, you have some that have been summons warrants, and other individuals have been arrested on spot. What is the difference in these two types of activity?
At the end of the day, there is discretion that can be applied by a police officer according to circumstances, and if you actually take account of Mr. Kane's comments, the majority of arrests were for nighttime curfews, and that presents a higher risk, a health risk, so we take affirmative action around it. The other things are breaches, where obviously a review in regards to the Act needs to be done by the DPP's office, and in some cases arrest is not required at the time, but summons can actually be taken forward as an option. And of course the other thing, Trevor, to mention is that we've issued numerous warnings and we record people's names. And I just want to say this, and it echoes everything that's been said. This is serious business, and actually the regulations are there to give guidance, but they are also there to be enforced. And if people choose to ignore them, they will find themselves with a criminal record, and that will be significant for them, but it's significant for others that we get the behaviour to protect people's health right.
Thank you. Premier, my last question. These queries have come to my network about a few nursery school parents that are being questioned to pay their dues. Schools have been out for 4 weeks. And one parent in particular paying $1,100. And these nursery schools are requiring the funds, and they're saying they're trying to hold their spots. If some parents are not working, how do they go about dealing with this situation?
I thank you for raising the issue. It's something that has come up. It's something that we're certainly looking to address on how to deal with that situation. There's been a number of persons who've written to me on via social media, and I've advised them what I've done. I am not paying for my nursery school when my child is not there, and I think that persons are able to go ahead and to make their own particular decisions. But I know that people are looking for guidance from the government, and what I would say is that I think that it would be wrong, immoral, and unjust for schools whose staff are claiming unemployment benefits to then turn around and try to charge persons in order to hold their spots. That is not something that is in keeping. I will seek legal advice on what the government can do in order to make sure that we can lay out a guidelines for people to follow, but I would strongly encourage persons not to do that. And if you are someone who is a runner of a nursery school and are finding yourself in that predicament, I would ask you to think about the community and think about what it is that you're actually asking people to do. This is a difficult time for all of us, and it is made more difficult by the challenges of which our community is experiencing with the premature loss of life of so many persons afflicted by this virus. The last thing which people need is additional financial stress that is put upon them when they have their children at home, cannot send their persons in, and being asked to pay for a service of which they are enabled by law in which to consume. That does not make sense, and we will figure out precisely what legal remedies of which they are. But I would advise parents not to do so, and I'll advise any nursery who is telling parents that if they do not pay, they'll lose their spot, to reconsider their actions.
One more last question. A private firm, I understand a private firm has been hired by government to take the supplies out to that vessel just off oil docks. Why not use government tugs?
Can't speak to that. That's the first I've heard. Do you have anything to add, Ms.?
Premium Ministers, good evening, and thanks for having us.
Can't hear you, sir.
Speak up, John.
Sorry, sir. Thank you for having us. There's a number of different questions that have been put to us. One of the questions we've been getting, we've been asked if there's any type of racial breakdown of the persons that have been infected so far that you might be able to give us.
Yeah. That question did come up the other day, actually, and the Premier and I had a discussion. The epidemiology and surveillance team has been asked to collect that. One of the challenges, two challenges potentially, are that on one hand, the reports are coming from the doctors, so the doctors are writing saying, could you please test ABC patient? And as you can appreciate, normally you can identify somebody by their sex by looking at them, but it's not that cut and dry as it relates to race, and it would require the doctors having to ask that patient to identify their race, which could create other, I don't want to say challenges, but insofar as identifying the race. But based on the conversation I had with the Premier over the weekend, I have tasked the epidemiology and surveillance teams to look at that. But it may not be as a simple fix as just as you would looking at somebody to identify their sex.
Right. Thanks, Minister. We've had a number of questions regarding various drug treatments that we're hearing of in the media, and forgive me if I mispronounce, the malaria tablet that has been in the U.S. media in particular. Any particular drugs that you might be able to tell us about, or new treatments that are coming into the island that we're trying on some of our patients?
Thank you for that question. I'm going to actually yield to Dr. Peekball, the Chief Medical Officer.
There are quite a lot of experimental uses of medicines in critical situations when we're at the end of the rope in terms of symptomatic management and sustaining patients. None have been shown through randomized controlled trials to be effective, but under these circumstances, there is quite a lot of anecdotal research and sharing of information, observational studies, and that such a thing. And as a result, there is some indication that there are medications like the one you mentioned, hydroxychloroquine, which has its uses and is quite a long time, well-established treatment for things like autoimmune diseases and malaria, as you mentioned. But it would be an off-label use to be used in this setting. That does not prohibit doctors from making that decision in critical situations, and so supplies of that have been particularly procured early by the infectious disease specialists at the hospital in anticipation of this. But most recently, studies have been rather mixed as to whether or not the medications are better than placebo, say. And then additionally, antiretrovirals are also being used in some settings, but the research is really quite preliminary, and I believe your question was whether or not there is anything that we have identified as an effective treatment, and the answer to that is no at this time.
Thank you, ma'am. Turning to the rest homes, regarding Matilda Smith, have we been able to test all of the residents and staff at Matilda Smith so far?
Like I said, Jonathan, there's more than 50 people that are actually being tested with respect to Matilda Smith, and we expect those results between the next 24 and 48 hours.
Thank you. Regarding, I know that staff work between different places. Have we been able, we've spoken of contact tracing. Within the last 2 weeks, do we know what places staff from Matilda Smith might have been called out to offer their services, where else they might have been working during the last 2 weeks?
I don't know.
The epidemiology and surveillance unit are aware of the alternate sites where people are working, but I am not going to actually release that at this time. But we are aware and have given the public health advice to reduce transmission in those settings.
Turning to the other home that was mentioned, are there plans to identify it at any point so that families may know?
Again, I'll yield to the home where there was the one person.
I believe the staff member.
The staff member.
Right. I'm sorry, I didn't hear the rest of the question.
Are there plans to identify the other home where the member of staff is, I guess, tested positive, just so that people who have folks in there will be able to know that?
Well, at the moment, I am reluctant to release the name of the home. We have done the investigation and realized that the risk is small at the moment, and we've identified about 4 people that could have been exposed. I'm reluctant to release the name of the home at this time.
Going back to Matilda Smith, so presumably the carers in that facility, they're just restricted to that facility at this time?
Well, as was indicated yesterday, some of the caregivers work at a number of locations. However, subject to the government has made a decision that we will be looking to amend the regulations as it relates to the residential care and nursing home regs, which will require that persons work at their principal place of employment, and they will not be permitted to be engaged in other types of part-time hustles, so to speak, at other rest homes, so that we can minimize the potential spread from rest home to rest home. So those regulations will be approved and gazetted very soon.
I know that we have limited resources in terms of caring for our seniors in Bermuda, but I'll still need to ask the question because rest homes everywhere that we've seen this have dominated the news. People want to know, can you walk us through why we have not been able to earlier on just say that they're just confined to one place in terms of the resources that we have realistically on the island?
I'm not 100%. I follow the question. I'm sorry, Jonathan.
We've been hearing for maybe 6 weeks now of some scary stories in rest homes around the world. People will doubtless ask why we haven't restricted the movement of staff between homes earlier.
Well, the residential care home regulation officer has been meeting regularly with the rest homes, and in fact, in March, the recommendation was for them to cease the process, the process of allowing persons to work at multiple places, and it was hoped that that would have been done on a voluntary basis. We see that that has not necessarily been the case, hence the movement to regularize it through the regulations.
Thanks, Minister. In terms of healthcare workers, are we at a point with testing where we're able to really focus on testing our healthcare workers as an at-risk population? They're dealing with sick people.
As you'd be aware, there is a global shortage of testing supplies, and so that is the struggle that we have here in Bermuda as well. Ideally, individuals who are working in a high-risk profession should be tested preferentially because they are with a vulnerable population, that is individuals who are not well. And so if there were an abundance of supplies, an unlimited amount of supplies, indeed, there would be very broad testing, and we look to the day when that will occur, hopefully sooner rather than later. In the present scheme of things, excuse me, hospital employees who are symptomatic obviously are tested quickly and isolated as well. Hospitalized patients are prioritized for testing. Individuals who are identified by their family physician as being at risk are tested according to a system of prioritization. And so there is at this time a need to balance the surveillance, looking for COVID-19 infections in the community, with the supply of testing equipment that's currently available. And because there is currently a limit to that, we have to be very judicious in who's tested.
Thanks for that. On a similar note, I know everyone is looking for ventilators at the moment, they're gold dust. Are you able to tell us where we're at for our ventilators and the projected need, depending on these models that we're looking at, that we may need of them?
That is a hospital question. I do know that they have been very, very meticulous at estimating the need, anticipating the need, and acquiring additional equipment, but I would prefer that you put that to them to give you precise numbers.
I had one final question. I don't know if anyone here will be able to answer it. We have had issues with separated parents, divorced people, in terms of visitation, where our shelter-in-place regulations have affected that in terms of being able to spend time with their children. Is there anything that can be done with the amending, I believe it's 3.3 of the shelter-in-place regulations, to make an exception for the handovers of children?
So we were very clear, Jonathan, when the legislation came in place, that it is up to the parties to work out a solution. So if they are meeting at a grocery store on a specific day and they're able to work it out, well, we want the parties to work it out amicably. In the circumstances where there is not a defined decision, Section 3.3 predicated that where we were at the start of the shelter-in-place, the child must stay there to the end of the shelter-in-place.
Thank you kindly.
Good evening. Following up on the testing kits and it's the swabs that we're short of, approximately how many swabs do we have to complete the tests, and how many are we missing? And is it just swabs or?
That's a laboratory inventory question, and it changes every day. I can say that the laboratory supervisor gives an update regularly. Over the weekend, I believe the number, we acquired some additional items so that the testing capacity went up from a very low number to something like 140. Laboratory inventory for COVID testing is quite complex. There are several ingredients that need to be in place. As we've talked before, it is a matter of several key items, any one of which can be the rate limiting step or can limit your testing capacity. My understanding is that as of today, it's more than 100, but there are items anticipated this week, which will raise that considerably. We hesitate to mention it because we have had some disappointments in this setting of embargoes and changing laws with regard to what can be transferred from one country to the other. But at the moment, we are able to test those who meet the criteria for needing testing at this time. And we continue to follow the World Health Organization's advice on testing, which, as you know, has expanded and allows people to be tested in the community who do not necessarily have a travel history risk, so that we're meeting the current need as we see it. But we look forward to having much more testing capacity available so that we can test without any particular criteria that limits us, and so that people, particularly those who need to be going back to work or need to change their lifestyle so that they can rejoin their families, that kind of thing can be done.
We know the United States has been one of those countries that have put restrictions on sending out supplies. India is another. Are there any other places that are causing us problems in getting these supplies?
I can answer that, Dr. People. You're right, Don. Unfortunately, the United States has, as the Premier indicated, I think at Thursday's press conference, a particular executive order, so to speak, from the President. However, likewise in China, the Chinese government have effectively, in order to try to curtail what other countries are seeing, is counterfeit, PPEs, masks, testing kits, and the like. They have actually said that from anything that's going to be exported from China, the Chinese government said that it must now go through a set of quality control. So, for example, some of the equipment that we've been trying to source from China for we might be very well on week 6 now. The Chinese government, as recently as last week, indicated no more PPEs can be, first it was N95s. They said you cannot export N95s without us first going through quality control. They've amended that regulation and now enlarged it to say that we now will not allow for PPEs to be, except for face shields. So face shields can go, but everything else that's a PPE has to go through quality control. It is a moving, as Dr. People said, it's a moving target. So the regulations with respect to the country, China in particular, seem to change daily. So as of today, that is, seems, well, as of last week, Wednesday, that was the position. If that's the position tomorrow, I don't know. We did have a conference call a couple hours ago with the source, our agents in China, and they've indicated they're watching the space because there's word to suggest that there's going to be an easing up of that particular quality control measure because of the drastic need worldwide for these supplies.
Okay, thank you. Mr. Premier, compared to other countries, Bermuda has a high mortality rate and a low testing rate. Well, not really low. We're in the top 25%, but as far in testing.
Yes, so I just want you to repeat that.
Yeah.
I don't want to say low testing rate.
No, 25%, I correct myself. But we're 15th overall in the world as far as mortality rate. Please comment.
I'm not entirely certain what you want me to answer.
Well, as of how concerned should Bermudians be that we're 15th in the world in mortality rate, and most of those countries that we're up there with, 10 out of the 15, are bigger countries, and there's 5 smaller ones like ourselves, like Andorra, and I think, I'm trying to think of the other, San Marino's another one.
I mean, there's different circumstances that happen, and as I started this by stating that we report these things as, numbers, and it's not as though if we know about the individual circumstance in which people are facing. But one of the things I think of which we've said before is that this disease affects those persons who have pre-existing medical conditions. And so when you have an incidence, as we do in Bermuda, a high incidence of non-communicable diseases, this could make our population more prone to that. Would I had wished that we avoided deaths inside of this country? Absolutely. Is that a realistic assumption or thought to have? Probably not. But the fact is that our jobs right now are to make sure that we do what is necessary to minimize that number. You would have heard me say last week that the modeling information which has been provided by the Epidemiology and Surveillance Unit has indicated that our worst case scenario is in excess of 700 deaths. We will be releasing that information publicly following the Cabinet having its review of it, and that may come later this week. But I think that it's important to recognize that as we are dealing with this virus, there will be persons who succumb to it as they have around the world. Our job is to make sure that we are taking the correct strategies in order to minimize that. So whether it is at the Bermuda Hospital, where I've managed to see where they have converted old wards to be ready for any particular surge, whether it was the response that Dr. Peake Ball had given towards the fact that they have acquired experimental treatments that can be used in compassionate care towards the end of life to see if that may help, which they're being able to do overseas, and additional treatments such as talking about plasma, et cetera. So there are lots of things that our hospital are doing. Our medical community, I want to pay tribute to them, the officers in the Ministry of Health, who under incredibly difficult circumstances this weekend managed to come up with a workaround for testing to enable us to test all those persons at the resting home today. And I can't get into the challenges of which individuals are working under, but let me just give you a story and an example. Last week, there was relief that we had received a supply of swabs and viral transport media. But in all instances, the department, the Ministry of Health, makes sure that these things are validated prior to use. The initial validation worked. The secondary validation did not work. So we went from a perspective where we thought that because we know that we have the testing kits in order to do the tests, but the question is, the swabs and the other things to put them in. So we ended up with a shortage. And so we're at this place where there are dictates from the political leadership that we have to make sure these persons in the rest home are tested versus the realities on the ground where, well, we don't actually have the viral transport media to transport those supplies. So what did our public officers do? Over a weekend where persons were with their families on the holiest weekend of the Christian calendar, worked, put together a workaround which was endorsed by the World Health Organization, and managed to mock up and put these things in place so that we were able to do that testing this weekend. And our health officers are improvising on the front line on any given day. And it is tribute to them, it is tribute to the team led by the Minister of Health, the Chief Medical Officer, and Nurse Jennifer Wilson, the head of the Epidemiology and Surveillance Unit, who are doing an amazing job to make sure that we can keep up. So in answer to your question, we have to do what it is that we can do. Would I like to say that we had no deaths? Absolutely. Does it pain me to say that we had deaths? Yes. It pains me even more because I happen to know some of the families who are dealing with that loss. And that is the reason why it is incredibly important for everyone to pay attention to what it is that the government is putting out to protect lives and to make sure that you recognize that in doing that, you are supporting healthcare workers who are doing their all to make sure that we can battle this.
I'm sorry if I didn't hear you exactly correctly, but of the swabs that we got last week, after they were tested, some of them were deemed not to be good enough, or
yes.
Okay. All right. Do we know how many that was?
No.
Okay. Just to follow up on a question from Thursday, I'm not sure if I asked it exactly the way that you understood it, but compared to since the pandemic began, you've been sorry, I'm just completely messed up on my list here. In some countries overseas, between 10 and 14% of those supposedly recovered patients are getting sick again. With the Ministry of Health, will the Ministry of Health consider extending the mandatory isolation period for those people for a longer duration? In like South Korea, they've had what they're calling reactivation, where patients who have been cleared have been getting sick again, and they feel like the coronavirus is hiding inside, not dormant, but latent, I think is the word that they used. So will we consider maybe that a longer period is necessary, or going back and rechecking with these people just to make sure that they're not reactivated?
I'm so happy to be joined by the Chief Medical Officer. Chief?
Thank you. I was actually hoping to be able to have that question, because it's an opportunity to talk about a couple of things. One is that it's very difficult sometimes to understand the statistical information that comes out of different countries. The example that you gave, for instance, of the reactivation potentially may be indeed a reactivation of disease, but it might also be that an individual was tested and was told that they had COVID-19 at a time when they were, it was too early to really prove that they had COVID-19, and it was a false positive, and then they eventually did get infected. There are situations where individuals may have had a very mild or subclinical case, and thereafter their immunity is not adequate, and they are then capable of getting infected. The point is that the evidence is really evolving. The information, the studies have not been done to really follow the natural history of the disease, and testing capacity is variable. It is somewhat unpredictable. There are countries using tests that, for instance, we would not care to use in Bermuda, or that have not been validated. And so the results are sometimes not what we expect, and it can be therefore difficult to compare country to country in terms of the natural history of the disease and what we're seeing epidemiologically. Likewise, even figuring out the mortality, what the mortality rate is, depends. That is a proportion, so that you're having to know the number of individuals who actually had the disease versus the number of individuals who die from the disease. So a ratio, I should say. So the problem there is, if you're not doing a lot of testing, the denominator is smaller than it would ordinarily be if you were doing a lot of testing. And so that you can sometimes, through statistical artifact, look as though you have a very high mortality rate when the problem is that perhaps you need to be doing more testing, and then you would find individuals who are asymptomatic or who have mild disease who actually live. So you would actually end up having a lower mortality rate. So the figure you mentioned about Bermuda being the number 15th, internationally, I think merits some further investigation, and it'll also be interesting to see how over time, when there is more access to testing and we can identify people who don't necessarily end up in the hospital or critically ill or who die, and get a real sense for what our level of care and our ability to address the diseases in the country. So I think that the point I'm trying to make is that it is very difficult at this point to make valid comparisons country to country, and the information has to be taken with a grain of salt.
Okay, well, they were doing it on a per capita basis?
Yes, that too. You can certainly, as you know, get statistical artifact from very, very small populations when you're dealing with very, very small numbers. Right. Someone gave the analogy to me that Bermuda has had a small number of individuals perhaps in the Olympics, and the number of medals in the Olympics compares quite favorably to that number of participants in the Olympics. So you really have to be very careful of the comparisons across jurisdictions because of the difference in population.
Just to get back to in the Bermuda situation, so once people are deemed recovered, to make sure that we don't have a false positive or latent or dormant or whatever term you want to use, what sort of checkup goes in after they've been deemed recovered?
In a resource limited environment, retesting is not practical. We have to limit the testing at this moment for those who are high priority. As I said, hospitalized, healthcare workers, those individuals looking after vulnerable individuals. But in days ahead, when we hope to have adequate testing, the gold standard obviously would be to assure that an individual has converted to being negative after they have been positive, so that they can be assured that they are no longer infectious to others. And in some limited areas where there is adequate testing supply, that is done a week or two after recovery. But we're not at the point of being able to do that at this time here in Bermuda.
All right, thank you.
Premier, I have another further question. By any chance, is the finance minister going to be presented? Because I've sent him a few queries, and this one particular lady is asking, she's a small business owner, a beauty shop of 9 staff, and she's paid out $7,500 this month to keep her staff insured. She's got no income coming in, and she's got maybe May is soon coming, and she's going to have to go in pocket to keep her staff. Her concern is that she wants to keep up her staff insured, but with no business coming in. What type of relief will she get?
The Minister of Finance will be joining me, I think, at this podium on Wednesday. But what I would say for that particular business owner, number one, I would thank her for doing her best to try to make sure that she can continue the health insurance of her staff. I think that's something that is very important, something that I commend business owners who are reaching into their pocket and sharing that particular sacrifice. So I thank her for that. If she has a specific query of which she wishes to have addressed, surely the best way to do is to contact the Ministry of Finance or the Minister of Finance directly. If she wants to send me an email at premier@gov.bm, she's welcome to do so as well, and that can be forwarded to the Minister of Finance on those specific things. But I know the Minister of Finance has been working hard in conjunction with the Minister of Labor, Community Affairs, and Sport to provide relief to employees who have been made unemployed due to the controls that are necessary to keep the spread of this pandemic to a minimum. But what we also need to do is to pay attention to not only our current plight of our businesses that are on island, but also the future plight of those businesses. And I do believe that the Minister of Finance will be joining me at this podium on Wednesday.
Any other questions?
With that, another question.
Yeah, just one last one. I'm sorry, Dr. Peekball. So after a person, since we're not doing the testing, do they?
I'm sorry. Start the question again. I couldn't hear you.
Sorry. After a person is either discharged or said that they're recovered. So because we don't have enough testing, is there some sort of follow-up where we ask them to check on their symptoms like 4 days later or a week later or something like that?
The current advice is that individuals who are positive are isolated for 14 days after the positive result, or 3 days after all symptoms have resolved, whichever is longer. So that is the protocol that's followed. So you're asking if there's anything
afterwards,
other,
just to make sure that they're not
any follow-up thereafter. That has not been put in place yet.
Okay, thank you.
Thank you very much. I thank the members of their media for their attention. I thank the ministers for joining me here today. I thank the Chief Medical Officer of the Nurse Epidemiologist and the Commissioner of Police as well. And I'd like to remind all persons that we are dealing with a situation and with a virus that does not discriminate. And I want us all to remember that we all have a responsibility in order to keep our country safe. I want to thank everyone for their continued support. I want to thank everyone for their continued prayers. And I want to ask everyone in Bermuda to keep in mind the families who are grieving this evening as they deal with the loss of loved ones due to this virus. Have a good evening.